Access to healthcare and financial services are two essential pillars to economic growth and sustainability, two areas where India falls short. Nachiket is the chairman of 3 organisations that's working to address this. He joins me now at the INSEAD India Business Dialogue in Mumbai. Nachiket, thanks for joining us on INSEAD Knowledge. Nachiket, can you start by explaining where the shortfalls are in India's financial services and healthcare sectors?
So I think in India we are falling short in a number of dimensions. We are a country of 1.2 billion people, 220 million children in schools, 5.5 million teachers, a population of 600,000 villages. On all of these dimensions, we have been unable to provide basic services to our population, whether they are urban or they are rural. And numbers vary, but people would argue somewhere in the neighborhood of 50 to 60% of the population does not have access to financial services. A much larger number does not have access to basic health care. And while in education, I think we've set up the infrastructure, we have the schools, right? But if you look at the quality of education that's going on, right? So you're getting the enrollments in grade 1, but children are just not doing well.
And how are these shortfalls being addressed?
I think the original ideas were around very much, this is a part of the government's responsibility, the government must get it done. So the government nationalized the banking system in 1969, the government built out a very large healthcare system, the government built out a very large education system. And that was the only model and idea that we had. I think it's pretty clear standing here that these approaches are not working, right? And despite best intentions, you're not getting to the numbers that you need to get, right? And I think each sector needs a different solution. In financial services, I think one needs a much more mixed market. In healthcare, I think it needs better design. In part it needs more money, it needs more services, but I think it needs more design thinking. Currently we have taken a hands-off approach. The government tries to run its own system and it says everybody else figure out whatever they want to do. If I can't do it, well, it's your problem, you figure out what your answer is. And even if you think deeper, I do believe there is a role there even for the private sector, but I think the government needs to take somewhat of a leadership role in the design thinking around this. In education, my sense is that the government, should be the provider, should be the financier and the provider. And I think a lot more citizen action, accountability work is needed to make that system perform better.
And what are you doing specifically to expand access to healthcare and financial services?
So in financial services, our belief is that the country needs a very large number of community financial institutions which partner with larger banks, insurance companies and mutual funds, right? But the community institutions are needed. And while this is not a new idea, many countries around the world have it. Even in India, we have tried repeatedly to build these institutions. What we are doing is trying to take another pass at it, using newer technologies, newer approaches to implement these ideas better so that we can actually go out. And so we have built 5 of these local financial institutions. We serve 300,000 families, 1.5 million people. We are spread out over 10 districts just now. So our goal is to try and find ways in which both through our efforts and as well as the efforts of other people, the country has anywhere up to 300 to 500 such community financial institutions or community banks. In healthcare, we are trying to understand the primary care dimension of it. Our sense is that India already has pretty low cost tertiary care services. We don't think there is a lot more value to bringing those costs down further. We think the problem we have is that there are too many people going to hospitals, and that is the only mechanism we have to deal with healthcare. Unfortunately, the reality that we find ourselves with, maybe it was always there, but certainly is much more visible today, that a large part of the disease burden is non-communicable, is mental illness, is routine eye care. A lot of it can be done at the front end, and in fact hospitals are not the right places to treat these issues. So what we have done is taken a population of 200,000 people in one of the rural districts of India, and we are building a new healthcare system for them, starting with primary care So we run 7 clinics right now, which we have spent a lot of time thinking about what the designs might be. Now, healthcare is not an area of deep expertise for me. It's an area that I'm learning much more about. But I'm hoping that these will be the interesting experiments from which, over a period of time, we can build a higher quality health system.
The doctor to patient ratio in rural India is said to be about 1 to 30,000. How can this be improved? You've previously made a suggestion that Ayush doctors might be the answer.
What we find is that the formally trained Ayurvedic doctor, not the local quack who learned through his grandfather, right? It's somebody who went to medical college, right? Did 5.5 years of training. 4 years of the training is identical to that of an allopathic medical degree, right? It is some key components like pharmacology, pharmacokinetics that he or she does not have the training needed to be a modern medical practitioner, right? We think this can be bridged very nicely through a nurse practitioner type program, what we are calling the Ayush practitioner program. So we have partnered with the University of Pennsylvania School of Nursing, who are the leading school in the world today for nurse practitioner training, to help develop a Ayush practitioner program, right? There are 800,000 such people in the system, right? Who we think need more work, who we think are easily trainable, and eventually we hope that it will lead to what we are calling integrative evidence-based medicine.
And in financial services, one of the companies you're a chairman of, IFMR Trust, helps provide capital to microfinance institutions. How is progress advancing here?
No, it's going very well. So one of the companies that IFMR Trust has is a company called IFMR Capital. We have now placed almost $1 billion of assets in the market. We brought new players into the system, mutual funds, private wealth, to become partners. We've been able to bring in, using the securitization type tools, particularly a new innovation that we have called multi-originator securitization, institutions that are working in remote parts of the country that the banks cannot access even if they wish to, right? And they cannot access banks if they wanted to bring some of this to the mainstream capital markets.
Care India, another one of your organisation, aims to fight poverty and empower women. How is the national mood changing in this area, and what more needs to be done?
It is true that there has been a heightened attention on issues like violence against women in the recent past for a variety of unfortunate events that have happened in the country. I think at a policy level, empowerment of women has always been a goal for the country. It's not that, I think the challenge has been getting it done. Everybody recognizes that this is important to do, but you're fighting age-old traditions, you're fighting inaccurate perceptions, and the inability of the state machinery to make it happen. So a lot of our work in Care India is actually a collaboration with the government to take good ideas that the government already has and help the government get it done better. So that if women want, for example, better access to contraceptive services, right? They've already had 3 children, they do not wish to have any more children, right? And they need now an intrauterine device to be placed, right? We've had this philosophy and policy for decades, right? But how do you actually make sure the service reaches women? That's really where Care India's role has been. So we are working in Bihar, for example, on a very large project with the government of Bihar, funded by the government of UK and the Bill Gates Foundation, in which what we are doing is bringing some of these essential services to women. I mean, we are not bringing, actually it's the government that's bringing it. We are simply helping the government get it done better. And we see that's what our strength is, and that's the path through which we hope to make impact.
Nachiket, thank you for joining us on INSEAD Knowledge.
Thank you. Thank you very much.